We are doing what's called a proof of concept exercise. We want to see, is it possible to fly casualties from the other side of the Pacific to the United States, and how do we disseminate them across local healthcare systems to make sure that they get the care they need? Our role is that we are a federal coordinating center. We use our clinicians, our staff, our resources to set up what's called a patient reception site. The patient reception site meets the aircraft, gets the casualties off board, and then we work with our community partners to find the appropriate bed for the casualties. We have a lot of different agencies here today. We obviously have the VA, we have the Colorado Department of Public Health, private entities, logistics support, we have technology support, we have non-governmental organizations, and this is what's part of what's called the whole community approach. We are using every available resource to come together to find beds for these casualties and these patients, and to make sure that they're getting the care they need. We bring a lot of resources, a lot of expertise to our communities to help respond to various types of disasters or crises. The fourth mission of the VA is to support our community during times of crisis, whether that be terrorism, natural disaster, whatever the issue may be in the community. The role of the VA is to support that. I think a lot of people in our community think the VA is just federal property and that we don't interact with our community, and that's not true at all. It's important because it keeps us ready and proficient to meet the needs of not just the nation, but our community too. You don't have to be an emergency manager to be prepared for an emergency. It's everybody's job.
A lot of what we did, I mean, it was the physical component, which is actually taking the gurneys, carrying the patients, transporting them, putting them on the cots, placing them in the chairs. It was also a lot of non-physical work in terms of communicating, making sure everybody was looped in, knew what their role was, knew where they were going, got the patients over to the transportation section. You go into a completely different mode when you participate in something like this, realizing that yes, this is a drill, but also this could be a reality. A lot of learning, a lot of different roles, different experiences, stepping outside of your comfort zone, doing something that you don't do on a daily basis. There were a lot of things that went well. I think we had good communication amongst our teams in terms of everybody knowing what their role was. My team did a fantastic job of switching gears when they needed to. There were a few times where we had to make changes to the direction that they were given initially, and so they did that really seamlessly. A little bit of learning that happened on the job. I mean, we had to switch gears when there were patients showing up without patient information, figure out who to get that escalated to, how to fix that, and by the end of the drill that had been fixed. In the emergency department, I mean, this is the stuff that we train for. It's the day-to-day work is a lot of fun, but this is sort of the other area of our expertise that we don't get to leverage as often. I think having a team of ED docs that are ready and prepared and willing to participate should a large-scale need arise is critical to the response that the VA can provide.